Good morning and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast series, once a week, we bring to you news and views about public health, infectious diseases, vaccines, and vaccination. I am Joe Schmitt, and with me is Dr. Melvin Sanicas. Good morning, Melvin.
Good morning, Professor Schmidt. Good morning, good afternoon, and good evening to those who are watching us or listening to us today.
The topics we're covering today is the link between meat products and type 2 diabetes. We show you the positive effect of Manuka honey on breast cancer. And we will have the good news that a nasal epinephrine spray is available and approved in the United States. I will then shortly give you an update on the outbreaks around the globe, Mpox and H5, and I will cover the effectiveness of Ebola vaccine in the Democratic Republic of Congo. But let's get started with meat and type 2 diabetes. Melvin, when I see this, I get hungry and I cannot wait to start my barbecue later tonight.
Yes, so really higher intake of heme iron, the type of heme found in red meat and other animal products. They are found mostly in cows, pork, and all the other animals that we normally grow in farms, right? They are associated with a higher risk of developing type 2 diabetes. And this is from a new study led by researchers at the Harvard T.H. Chan School of Public Health. The link between heme iron and type 2 diabetes has been reported previously, but the study findings that we are talking now, they more clearly establish and explain the link. Compared to previous studies that relied solely on epidemiological data, in this study, the researchers integrated multiple layers of information, including epidemiological data, conventional metabolic biomarkers, and metabolomics. And this allowed the researchers to achieve a more comprehensive understanding of the association between iron intake and type 2 diabetes risk, as well as potential metabolic pathways underlying the association. They also analyzed the biological mechanism underpinning heme iron's relationship to type 2 diabetes among a smaller subset of the participants. They looked at 37,000 participants, plasma metabolic biomarkers, including those related to insulin levels, blood sugar, blood lipids, inflammation, and two biomarkers of iron metabolism. And they looked at 9,000 participants' metabolic profiles, plasma levels of small molecule metabolites, which are substances derived from bodily processes such as breaking down food or chemicals. And the study found a significant association between higher heme iron intake and type 2 diabetes risk. And participants in the highest intake group had a 26% higher risk of developing type 2 diabetes than those in the lower intake group.
So this is a very interesting study because it is not only observational. Those who eat more meat, they may eat more sugar and they may be more smokers or drink more beer, I don't know. But this is supported biological plausibility study by other factors or by the factors that may be behind the pathogenesis of cancer in those or type 2 diabetes and meat consumption.
That's right.
Very interesting. So this is really a big step forward, right? This is not just another nutritional study, but this is really high quality, good type of evidence now.
Yep, it's adding to the previous studies that are just looking at databases or epidemiology, because this is really adding biological plausibility. Yeah.
Yeah, excellent. And you have another piece of information on nutrition, and in this time it is breast cancer. And maybe you can explain the secret of Manuka honey.
Yes, so a new study led by investigators at the UCLA Health Johnson Comprehensive Cancer Center found that Manuka honey could potentially be an alternative natural option for breast cancer prevention and treatment, particularly for those with estrogen receptor ER positive breast cancer. And this is the most common type of breast cancer that accounts for about 70 to even 80% of breast cancers out there. And maybe our listeners or viewers are interested to know what Manuka honey is. It's actually not the same as the regular honey or just glucose because it contains glucose as one of its components, but it also has other components like fructose, methyl glycosal, and dihydroxyacetone. And this is a particular type of honey that is found only in New Zealand because it is produced by bees that pollinate the Leptospermum scoparium bush. It's very difficult to say, and it's only found in New Zealand and parts of Australia. So, in this particular study, the researchers at UCLA found that Manuka honey significantly reduced tumor growth in mice with ER-positive breast cancer by around 84% without affecting normal breast cells or causing major side effects. And they also found out that higher concentration of Manuka honey led to a greater reduction in cancer cell growth. So I think this is promising. Of course, this is a preclinical study. It's in animals, but as we all know, all those treatments that we have now for breast cancer, they started with animal studies as well. So I think this is a good step.
This is wonderful. Very good news. But the question then is if the investigator looked for any other type of honey, if there was an effect as well. So is it the honey, some ingredient in general honey, or is it some very specific ingredient from that Manuka plant that is the effective principle here?
I don't think it's the sugar or just honey per se because Manuka honey is special because it has methyl glycosal MgO and dihydroxyacetone DHA, and these two are seen only in the Manuka kind of honey.
Okay. So this is very interesting. I trust you keep us posted on Manuka honey and also on barbecue meat. Yeah, I'm looking forward very much to hear about what is going on there in science. It's really exciting that we get beyond simple observational studies. Melvin, you have one other good news for today.
Yes, so the US FDA has just approved a few weeks ago the first epinephrine nasal spray for emergency treatment of anaphylaxis. And this option offers a needle-free method to quickly treat life-threatening allergic reactions, potentially reducing barriers for both children and adults who weigh over 66 pounds. And this is important because, as we know, allergic reactions happen when a person's immune system reacts abnormally to a substance that normally does not cause symptoms, right? And it is a severe life-threatening allergic reaction that typically involves many parts of the body and is considered a medical emergency, and you can die if you are not given treatment immediately. And epinephrine is the only life-saving treatment for anaphylaxis and has previously only been available for patients as an injection. And so this new product, Neffy, it's called Neffy. It was approved based on 4 studies in 175 healthy adults without anaphylaxis. Of course, they were not looking at anaphylaxis or prevention of anaphylaxis as the endpoint, but it's actually looking at whether the epinephrine levels in the blood will be the same as when you do it as a nasal spray or when you do it as an injection. And results from the study showed comparable epinephrine blood concentration between Neffy and approved epinephrine injection products. It also demonstrated similar increases in blood pressure and heart rate as epinephrine injection products. These are the 2 critical effects of epinephrine in the treatment of anaphylaxis, right? Increasing blood pressure and heart rate. And so this study was approved. This study was good enough for the FDA to approve this new product of epinephrine nasal spray.
Melvin, I just love it. This is a very good medical decision and a very good licensing decision based on biological plausibility. And it is an example for that the license can happen even in the absence of clinical evidence. So there is no evidence that this device will save the life of anyone with anaphylaxis.
Mm-hmm.
But the way it works, by the biological effects and by the resorption of the substance, as documented in 175 healthy subjects, it must work. If not, it would be a miracle, right? So it is even licensed in the absence of clinical data. I guess if you are a Cochrane person, you won't like that. Cochrane only accepts clinical data. But this is a very good example for the limits of the Cochrane reviews, right? This is the type of new thinking we need whenever possible. If you want to do a clinical study with anaphylaxis, you need, I would say, very many patients, and you wouldn't have the device at hand, right? If you would have the device at hand, you would also give the patient at the same time the injectable version, and you can only use the injectable one because that is proven to be effective.
Mm-hmm.
So you cannot do a double-blind randomized study with that one, right? So I think very interesting, very good results for all these allergic patients out there, and very good for medical use and science. I think it's a very nice example, and thanks for bringing this to us. Any other comment or?
This is not yet approved in Europe, but it will be in the end of the year.
Hopefully. Okay.
Hopefully.
Yeah, and you probably don't know the price yet. Yeah, it won't be cheap, yes, but yeah, this is really fun, right? So, as an emergency physician, that is what you need, right? This is what you should have at hand all the time. Yeah, very good. Look, I'm covering Mpox and I'm covering H5 bird flu, and the first news is that this booklet, Global Mpox Strategic Preparedness and Response Plan by WHO, is available, and the link is down here. Very nice. You can download it for free, and it is very good information and advice. The second, and that is what I spent the last days with, is finding the classification of all these pox viruses. What I told you last time in our Global Health Cast 75, there are 4 orthopox viruses: the smallpox virus, variola, the cowpox virus from cowpox, the vaccinia virus, which is the strain that was used to protect against variola, against smallpox, but it initially was a cowpox virus, and over centuries developed into another strain, into another species, and that is now vaccinia virus. And then out there in the jungle, there was always the monkeypox virus or Mpox virus, and that these 4 are known to cause human disease, and they are orthopox viruses. Then there is a large group of non-orthopox viruses, and some of them may cause human disease. Number 1 is the big group of parampox viruses, and that includes orth viruses and pox viruses of sheep, goat, and cattle. Then you all probably know molluscum contagiosum, which are warts that are donut shaped. Many patients with a T-cell defect have that, and they're transmitted from human to human, like the smallpox, easily transmissible if there is a T-cell defect, like AIDS patients, cancer patients, other types of T-cell defect. And finally, there is the Yatapox virus, 2 different viruses that exist out there in Africa. Very few human cases have been described. It's largely an animal virus. Now, I took off from the non-orthopox virus and the parapox viruses. They are parapox viruses that only known to cause animal disease, and I've listed them here. So the background, and why do I bring this all up? There are various pox viruses out there in animals that potentially could find a way to jump to humans, provided there is sufficient exposure. If none of us meets the New Zealand red deer, we won't have a chance to come to human cases with the parapox virus of red deer in New Zealand. So again, this is a very large group of parapox viruses that are only known to cause animal disease. Melvin, any Any comments on this slide here?
This is good that the WHO now has a global strategic preparedness response plan, and this is something that they've launched today, actually, so
Yeah.
that this can be used by not only countries with current Mpox outbreaks, but countries that are surrounding those countries with Mpox outbreaks.
Yeah. Very briefly, H5N1 or H5 from the United States. In the US, they tested 43,000 specimen for H5, influenza A H5. They monitored 4,000 people that had been exposed to H5. They tested more than 230 of these exposed people, and they found 13 human cases of H5. So the good news so far is the transmission of H5 does not happen human to human, but only heavy exposure from birds to humans, and then you occasionally may come down with H5 disease. And let's look at the animal side. There have been almost 10,000 animals been detected with H5, 100 million with poultry, 190 dairy herds, so probably almost 200,000 of animals. The organism has been detected anywhere in the United States. There have been 48 outbreaks in the United States and in poultry and 13 in dairy cows. So this is the situation. And again, despite the widespread presence of H5, there have only been 13 human cases. So this is good news so far, and we just hope that it will stay that way. Any comments on H5 from your side, Melvin?
This is good news so far, I think.
Yeah. Finally, we covered the efficacy of a vaccine against Ebola in one of our previous global health casts. And you may remember that the efficacy was 100% in a cluster randomized study. And one effectiveness analysis, VES, it was 98%. Now, here I'm covering a retrospective analysis on the effectiveness of this vaccine using a test design. I don't go into the details, but basically you conduct the test, you look who is positive and who is negative, and then you look for the vaccination status, and then you can calculate the odds ratio of the effectiveness of the vaccine. And this is the result. And what you see here is that the effectiveness is high, usually above 80%. Only if you give the vaccine late or delayed after exposure, then efficacy goes down to, let's say, 18, 19%. But again, no vaccine can work before the immune system has reacted. So if you have been exposed today, you are infected, and then you give the vaccine after a week, you cannot expect that the vaccine is efficacious. So in the end, this is confirmation that the vaccine is efficacious in the area where it has been used. Any comments, Melvin, on Ebola vaccine?
This is good news, right? That we know that the vaccine is really working, and this is supported by different ways of looking at the different studies in the countries where Ebola is spreading.
Yeah. Very good. And having said that, we come to the end. Apologies. What we talked about today is the link between heme iron in red meat and type 2 risk diabetes. We spoke about preclinical studies showing that Manuka honey may be able to prevent breast cancer as shown in animal experiments. And the good news of the day was that epinephrine nasal spray has been approved in the United States, and it will be approved. It is expected to be approved by EMA by the end of the year. I give you an update on Mpox with showing you that there are more animal pox viruses out there. And we showed you that H5 is very much out there in nature, in birds, in poultry, and in cattle, but human-to-human transmission has not been detected, and the 13 cases presented, they result from bird exposure. And finally, we covered the effectiveness of Ebola vaccine. Finally, Melvin, you have the funny of the week.
Yes, it's not really funny, but maybe something that's insightful for people. If you see here all these different bottles of water, the price is like 50 cents, $2, and $6, and it's all the same bottle of water. The only difference is where it is, right? So I think um, next time you doubt your worth, maybe you are in the wrong place. Maybe you are just in the supermarket, not at the airport.
Yeah. So plan, if you know you're going to need water, plan for buying it early on in the supermarket and not in the airport. Yeah. Well,
Exactly.
actually, I guess it is even worse. You don't have a chance to buy it at the airport because you need to pass security and they won't
Exactly.
let you
So
with
what
the
you need
water.
is you buy water, drink it before you pass through security, and when you're
Yeah.
inside after security, you can get through the water fountain, right?
Yeah. This was our Global Health Cast 76. Thanks for joining us today.
Stay safe, everyone. Thank you for watching and listening.